This is The Source on Texas Public Radio, 89.1 FM. I'm David Martin Davies. San Antonio has been named a dementia-friendly city by Dementia-Friendly America. Now there's a lot of work to do in the community to take that designation to heart and take it to the streets. Why is it important that San Antonio is a dementia-friendly city? What does this mean for those who have been diagnosed with dementia and those who care for them? We want you to join our conversation today as we talk about caregiving for those with dementia. Tell us your story. Tell us what's happening. We know that almost every individual out there, you have someone in your family, someone in your circle that has been diagnosed with dementia and they need special care. How are you dealing with that today? What can you pass along to the community as we are a dementia-friendly city? The number to call in is 210-614-8980, 210-614-8980. What do you want us to know about dementia in your life? Give us a call. You can also email questions and comments to the source at tpr.org and tweet at us at tprsource. We're joined this hour with Carole White. She's a professor and a leader in the Caring for the Caregiver program at UT Health San Antonio School of Nursing. Carole White, welcome to The Source.
Thank you.
Dr. Charles Reed's here, Vice President and Associate Chief Nursing Officer for the University Health System. Charles Reed, welcome to The Source.
Thank you so much.
And Ginny Funk, Program Director of the Alzheimer's Association San Antonio and South Texas Chapter. Ginny Funk, welcome back to The Source.
Thank you.
So who wants to tell me what exactly is a dementia-friendly city? Okay, Carole White.
Yes, I'd love to. So Dementia-Friendly is really an international movement. It's a social movement. While we look for a cure for dementia, how do we support people in our community to feel respected, included, be able to engage in their community as they like? So we were designated Dementia-Friendly San Antonio by Dementia-Friendly America this past spring. And Dementia-Friendly America is really a national network of communities, organizations, and individuals seeking to ensure that communities across the U.S. are equipped to provide support to the growing number of people living with dementia and their caregivers.
Yeah, and they have a great website, dfamerica.org. You can find out more information there. So designating a city or other cities or communities dementia-friendly seems like we're trying to solve a problem. What is the problem that we're trying to solve?
So the problem is this growing tsunami of Alzheimer's disease. We know there's over 5.8 million people living in the U.S. There's 16 million family caregivers. And I think in San Antonio, we're particularly vulnerable to this issue. We know that Hispanics are about 1.5 times more likely to develop dementia. So given our demographics, that's important. We also are the #1 retirement city for the military, USA. So that also adds to the demographics of older individuals. And I think all other risk factors pale in comparison of age. As our population ages, over 65, 1 in 9 are likely to experience Alzheimer's disease. Over 85, somewhere between a third and a half of people will have some form of dementia.
So you're describing how, as we have this aging population, we have this chronic illness, a condition that people have develop, and that we have to come to an understanding as a community about how it presents itself and what does it mean, and to avoid misunderstandings.
Families tell us that the biggest challenge they face after getting the diagnosis is the stigma. I think dementia is not unlike where we were with cancer 40 years ago, where people didn't talk about it, they didn't tell people about their diagnosis, but then they started talking about it, they started walking for cancer, they started raising funds, supporting one another, and now we have lots of cancer survivors. So I think that's what we see as we deal with the stigma and challenge people to support this growing condition.
But like Ginny Funk with the Alzheimer's Association, occasionally we see these alerts where there have been people who are having memory issues or they seem lost and confused, they're in the community and they need help. Educating the public about dementia, does that give us a better advantage in dealing with these types of situations?
Absolutely, because one out of seven individuals with Alzheimer's disease at some point will wander, either by foot or by car. So particularly when you see silver alert come up on the highway, a lot of people have no idea really what that means. And that whole program was thankfully now nationwide. And it looks at, if you see Silver Alert, that means that someone is actually in that automobile, they're driving, and they're lost. And so that's why we see Silver Alert that'll come from Amarillo, but yet we'll see it in San Antonio, because we know that oftentimes all it takes is a confused instance of not turning right, turning left instead, and ending up in a whole other city or whole other place. So absolutely educating the public about what to do, what Silver Alert means for sure, and to be aware of when you are, for example, when I hear Dr. White talking about dementia-friendly, I think about when you really get down to it, we're talking about a community where when you go to the grocery store or you go to the bank or you go to the dry cleaners, just being aware of all of the individuals that are in our midst that have dementia and Alzheimer's, and what to look for, how they may be confused. Or I can't tell you how many times I've come out into the parking lot of HEB and found people who looked really confused. They can't find their car. But we know Alzheimer's disease.
That's me.
Yeah, that's all of us, right? But we know with Alzheimer's disease, it's not just losing where you parked the car. It's really going to, finally, when you find your automobile, not knowing exactly what to do, not knowing how to get home. So it's so much more serious. And I just think dementia-friendly, when we look at, again, community-wide with Silver Alert and everything, making sure that people understand the prevalence of this disease. We may still not be talking about it near enough, but we are surrounded by individuals, and not just older individuals, but there's a significant growing group of individuals who have younger onset Alzheimer's, so they're less than 65 years old, that they are amongst us. And so how can we as a community, again, Dr. White was talking in the lobby about, we're this focus on being age-friendly as a community, but you really have to then include dementia and Alzheimer's when you're talking about an age-friendly place, because of the prevalence of all the people out there who have some form of dementia, whether it's Alzheimer's or another kind.
Right, and we have to be mindful that these individuals are out there. They may come in contact with law enforcement, and law enforcement needs to be trained to, or first responders, how to identify, is this person, are they on drugs, or what's wrong with them? No, they're dealing with dementia, and maybe there should be, or there probably are, ways of coping with that. Bracelets or something. How do you bring that across?
Absolutely. So there are several different programs. The Alzheimer's Association joined in partnership with Medical Alert. So we actually have Medical Alert Safe Return as a designated way to keep identification on someone.
All right.
However,
but you have to sign up for that. You got to be registered. There's all sorts of steps involved.
Yeah.
So we're going to have to go through that. And we're going to come back from the break. We'll have time to dive into that and other issues, because, we're talking about dementia and we're talking about Alzheimer's. If you have Alzheimer's, you have dementia. But if you have dementia, it doesn't mean you have Alzheimer's. There's other ways of other conditions that are out there. So we'll talk about that as well. The number to call in, we want to talk to caregivers and learn what you have been going through and hear your story. The number is 210-614-8980. The Source continues after this break. This is The Source on Texas Public Radio, 89.1 FM. I'm David Martin Davies. We're talking about San Antonio being a dementia-friendly city and dementia caregiving. Also with us is Charles Reed, Vice President and Associate Chief Nursing Officer for University Health System. And of course, one community that's going to be coming in contact quite a bit with folks who are dealing with forms of dementia is going to be the nursing community, the healthcare community. So, Charles Reed, how do you get them ready for this tsunami?
Well, 1 in 4 patients admitted to the hospital have some form or they're in some stage of dementia. So in 2018, we had 31,000 admissions, so 7,500 of our patients admitted to the hospital had dementia or some form of it. And so we really need to find innovative ways then to help train the nursing staff and the physicians about dementia and how to provide that care in the settings, because when patients are admitted to the hospital, that hospitalization exacerbates that underlying condition. And so you may see those behaviors of pulling lines out and pulling IVs out and stuff. And so how can we help the staff redirect those patients to keep them safe in that inclusive environment? And so we're implementing a virtual dementia tour in assistance with the UT Health School of Nursing. So we were actually putting some of our providers through a dementia training program where they actually get to experience dementia, what it's like. And that is extremely eye-opening because it really gives them empathy and understanding. When these patients go home, how can we help them in the home environment? When we're giving them instructions, you don't give them 3 instructions, you give them 1 instruction at a time, let them complete that task. And so we're really developing, tools to help the patients while they're in the hospital and to help get them home. One of the things we've done in partnership with the School of Nursing and the University Health System Foundation is that we've developed a diversional activity program so that we have this customized program in assistance with our therapists that we can find activities for them to keep them occupied and in the bed and safe so that, once again, they're not exhibiting those behaviors that may compromise their care in the hospital.
How do you replicate the symptoms of dementia in those training events?
There is the virtual dementia tour. The tour itself is only about 8 minutes, but you have.
So is it in a computer?
No, it's you garb up. So you have gloves on your hand. You have special glasses. You have headphones on, and you will go into a simulated home environment and perform different tasks and understand the struggles of those simple things of, putting on your jacket and following instructions and counting out money and looking for different things and performing those tasks. And even in the hospital, when we bring in a tray and you say, hey, Mr. Jones, I'm gonna give you this medication and here's your food tray and here's that, that's way too much information. So we need to slow it down and really give them one piece at a time. Help these patients understand, because we're giving them so much information at times they're not understanding it.
Have you gone through that thing with the goggles and the headphones?
I did. It was very eye-opening, and once again, it's you realize that you pray to God that you're not that you don't get inflicted with this disease.
But statistics tell us that either you're going to get afflicted with the disease or you're going to be a caregiver for someone with this condition. It's
Correct.
just going to happen to all of us. So everyone needs to be paying attention to what's going on. The number to call in is 210-614-8980. Let's go to the phones with Arturo. Arturo, welcome to The Source. You're on the air.
Good afternoon. I just want to let you know about my wife has Alzheimer's, and she was diagnosed about 2 years ago, but we started suspecting something was wrong really about 3 years ago. And I've been listening to all the advances, so to speak, of what's that is going on for the treating Alzheimer's patients, and I'm really glad to see that UT is up there in the front lines, trying to help the community or the medical community understand and be able to treat the Alzheimer's patients. Through past experience of my father-in-law, we had a bad incident that the people at the trauma center did not know how to treat a Alzheimer's patient. So I'm glad that is now going on, and as a caregiver, I feel that my prime job is to have, first of all, give her and make sure that her needs are met, make sure that her dignity is preserved by all, and above all, patience, lots of patience.
So, and Arturo, have y'all been planning? Do y'all have a plan?
I'm sorry?
Do you have a plan? I mean, because things are going to get. I mean, it's a rough road you're on, buddy.
Yes, and right now I'm fortunate enough that my wife is very. Her cognitive functions are still very good, and but I know what's facing me, and that's one of the things that I would also like to bring up is that I was put into this job, if you will, and it's an OJT, and I'm constantly questioning myself: am I doing the right things at the right time?
All right, so, Toto, thank you so much for calling in. You bring up a lot of great issues. Let me go first over to Carole White with the UT San Antonio School of Nursing, and you're leading the Care for the Caregiver program there. People like Arturo, they're given a job that they didn't apply for.
Yes, and they're given a job that they haven't received any training for as well. So that's a big part of what we do in the Caring for the Caregiver program, is provide regular education for family caregivers. When I've talked to caregivers, they talk about how desperate they are for information and education around the time of the diagnosis, even understanding dementia. So we offer classes once a month. We call it the Essentials of Caregiving, that walk caregivers through what they might need. Arturo was talking about wondering if he's doing the right thing. We also offer once a month a skills workshop that we bring in multiple professions: dental, nursing, nutrition, occupational therapy, speech language, to help caregivers learn their roles. Some of the statistics suggest that over 50% of family caregivers take on medical and nursing tasks for which they receive absolutely no training, which is frightening to them, frightening to us. So we offer these programs. Caregivers can learn about our programs at utcaregivers.org. We've been able so far to provide all these programs for family caregivers free of charge to the caregiver, and we have parking provided around the School of Nursing and at the Medical Arts and Research Center.
Jenny Funk with the Alzheimer's Association San Antonio, South Texas chapter, when people first get the news that your loved one or you have been diagnosed with Alzheimer's, they're going to have so many questions.
Absolutely.
Do they come to you guys?
Absolutely. So the Alzheimer's Association has a 24-hour helpline. It's free, of course, but it's available in over 200 languages. We actually just met a family that needed to speak with their mom, who was starting to revert back to speaking Japanese. So we encourage them, call our helpline. There are translators. So when you call the helpline, again, it's 24/7. So if it's midnight and you have questions, or you're right in the middle of something and you're not exactly sure what to do, or the emotions that come up with this, the anger, the fear, the sadness, it really helps a lot to be able to talk with someone who gets it, who understands, who often has also been through it themselves and has resources and really offers a very caring listening ear. So we highly, highly recommend calling our 1-800-272-3900 helpline. And
Right.
From that, we can get you connected to all kinds of resources in our community, support groups, and all the classes that we offer, and all the classes that Caring for the Caregiver offers that Dr. White just mentioned.
Yeah.
There are a lot of resources available. It's just, I think the hardest thing sometimes is initially picking up the phone, because you have to reach kind of a little bit of a level of acceptance that this is real, this is happening, but reach out and you won't be alone. We guarantee you for the rest of your journey, you won't be by yourself. There are a lot of resources available in our community.
So Arturo also had a question. Producer was able to funnel to me. This is, what's the best way to manage mood swings for someone with dementia? And so who wants to take that question? I mean, I'm not getting any takers here. So I'm going to pitch it over to, I'm going to give it to Carole White. What do you do? We have, mood swings, how do you deal with that?
So we do know that depression can accompany dementia for many reasons. So it's to really understand what is it. We always try to use non-pharmacological interventions before we go to pharmacological.
Like music,
yeah.
things like that.
Yeah, and it also to try to find what triggers it as well. So we teach caregivers. We have a program now where we go in the home, the COPE program called Caring for People with Dementia in Their Own Environments. We teach caregivers to try to look at what might be some of the triggers and then to brainstorm about potential interventions and then to try those out. I'm always trying to stay away from medications as the first line for these individuals.
I'm going to go to another caller. This is Mary. The number is 210-614-8980. Mary, hi. Welcome to The Source. You're on the air.
Thank you. Before I tell you my story, I have to say I am so thankful for the Alzheimer's Association and for UT School of Nursing. When my husband was diagnosed 5 years ago, the neurologist basically said, I'll see you in a year, and gave me absolutely no information at all. And I was just like I'm floating in the ocean. And it didn't get any better with the second neurologist because the first one, at any rate. Ginny has been helpful in a very difficult situation when my husband lost his license and was so angry, and she helped talk him down, and it was so good. Carole's been so kind, and we participate in the Grace Notes choir with for people living with Alzheimer's and their care partners, which has been wonderful. But the story I wanted to tell you is we have both the Med Alert bracelets. Mine's for a caregiver, and my husband's is for someone living with Alzheimer's, because he is a wanderer. And usually the wanderers would just be in our neighborhood. But one day when I, heaven forbid, took a shower, he left the house and wandered down the street. We live in the north side of town. Down the street, it kept walking and apparently kept going. And I figured he was not in the house pretty quickly. And I also have an Apple Watch, and I can follow him on his Apple Watch. I thought he was walking because that's what he usually does, and he was going too fast. I was in the car, and he was going way too fast. I finally got all the way down to Hildebrand. Now, we live up at 1604 North, all the way down to Hildebrand, and I called the police to come help me. And officer came and looked at my phone and saw that he was still traveling, and she figured he was on a bus. My husband has never been on a bus in the 30 years we've lived in San Antonio, and he doesn't have any money. And he has this bracelet, but he was on a bus. Finally, apparently, he got off the bus, or it was at the end of its route or something, and he was someplace south of the cathedral. She sent 2 officers to go look for him on the river walk and around, and they found him in a hotel lobby, sitting. He was fine. But, the point is we have these bracelets, and yet the police officers didn't see it. The bus driver didn't see it. We really have to alert the police. I know that Salazar is very aware of it, and Sheriff Salazar, but the police, all different groups that deal with public need to be aware of these sorts of things. And
Mary, thank you for the call, and that's exactly where we need to be talking about today. And we are trying to get the public, raise awareness, reduce the stigma, shatter the isolation of folks with dementia and the people who care for them. When we come back, we'll talk more about that and talk more about Mary's story. Welcome back to The Source on Texas Public Radio, 89.1 FM. I'm David Martin Davies. We're talking about dementia and having San Antonio be a dementia-friendly city. What does that mean, and what does it mean for not just those with dementia, but also for caregivers? With me in the studio, Carole White. She's with UT Health San Antonio School of Nursing. She's the leader of Caring for the Caregivers program. Charles Reed is the Vice President and Associate Chief Nursing Officer for UT Health San Antonio, UT Health System, and also Ginny Funk here, Program Director for the Alzheimer Association San Antonio and South Texas chapter. We had that call before we went to break, and Ginny Funk, what do you make of that?
Oh, my goodness. Well, unfortunately, we hear that a lot. There are a lot of, like we talked about before, the likelihood of someone wandering with Alzheimer's disease, even if they're in a familiar setting, all it takes, just like with Mary and her husband, it just took a split second of again, it's very difficult to be around and watch someone 24 hours a day. So in that split second, you have a situation where I have no idea how he was able to get on a bus and then continue on like that. But we hear about it a lot. Individuals who, again, get lost, they end up in another town, they end up in another state. And it's,
But it's interesting she had that Apple Watch thing to help her.
Right, which there's a cost associated with that, but certainly if you can do that, that helps a lot. So that's going to be sort of like a GPS system. The association, we have Medical Alert Safe Return, which is basically an identification bracelet that a person with dementia is not able to remove. So they always at least have identification on. But you have to be aware, so first responder training that we're doing, you have to be aware that someone may have a Medical Alert Safe Return bracelet on, and that if you turn it over, you can then call that phone number, put in the ID of the person, and immediately find out where they live, who their caregiver is, etc. So it's such a frightening situation. And we
not
know
uncommon.
Not uncommon whatsoever. And there are a lot of instances where there's not necessarily a happy ending where the person is found and they're returned home safely.
And Carole White, the caller talked about the bracelet. They did have the bracelet, but still it seemed like that wasn't the thing that saved a day.
Yeah, so the importance, as Ginny said, of making sure we train not only first responders, but even people who might notice someone who looks a little confused, to know how to approach them, to go up and speak with them, look for that bracelet and be able to support them. There's a training so we talk about Dementia-Friendly as a community-wide initiative, a grassroots initiative, but there's also training that individuals can take called Dementia Friends. They can go to the website Dementia Friends USA, or they can also call the Caring for the Caregiver program 210-450-8862 and ask for an on-site in-person training. But in this training, there's a core module, but then if you're a first responder, if you're a library, if you're a business, it gives you some hints of how you should approach people, what are the things you should look for so that you can support a person living with dementia and their family.
So Charles Reed, you talked about earlier how when the medical community comes in contact, maybe a first responder, with someone who has dementia, and there's sometimes some conflict there because you don't know who you're dealing with, you don't know that person's not communicating well, sometimes maybe they react in a hostile manner. Are there things that, like a bracelet, or maybe if they had some sort of laminated card or something with them explaining that person's condition, how can we think forward about what happens when things go badly? They do end up in the emergency room. I mean, you have to prepare for those things. What can they do?
The bracelets are a great idea, but also I think it's understanding what Carole said earlier. So what's that clinical trigger? Because we will get patients in from nursing homes who may be ill, who are combative, and you're not understanding what's going on. So it's really that disease process. But we do a lot of training in our organization with de-escalation techniques to helping to calm down. We had an incident recently where we had a patient who was becoming very, very agitated, and someone reached out to our dementia coordinator. She went down and brought the virtual activity book and stuff with them and helped them understand. He was frustrated because people couldn't understand. He wasn't able to relay what he needed. They weren't understanding him. So she was able to help diffuse the situation. And once we had him doing the activities, it was perfect. I mean, no more escalation. And so it's really about teaching those de-escalation techniques, understanding what those clinical triggers are, and bringing awareness to the staff. As Arturo mentioned before, people may not always know when these people come in the emergency department, or our emergency medicine physicians 2 weeks ago reached out to us. They want to be the first ones to go through our dementia tour because they really want to understand what is it like and how can they better serve the patients that come to our emergency department.
Back to the phone lines, 210-614-8980 with Louis. Louis, welcome to The Source. You're on the air.
Hi, thank you. I just wanted to tell the story of my dad.
Okay.
He had a brain bleed that once in a while would act up. And so he would sort of lose consciousness, but he was still moving around, and he explains that he was gasping for air, and, he thought he was drowning. So, of course, my mom would call 911, and he couldn't communicate this to anyone. This is after the fact. But my mom, whenever he saw him in one of these episodes, would call 911, and first responders would show up with the description of the call as if it was someone attacking my mother. And we went down to the police department to tell him, this man is sick. He doesn't need to be restrained. But 3 out of the 4 times, he ended up in an ambulance with handcuffs and bruises and multiple people on top of him, because he couldn't recognize that he was sick. He needed medical help rather than being restrained as someone who was belligerent or attacking another.
All right, Louis, thank you for the call. You really help us transition to this really important point about what happens, how being a dementia-friendly city means training law enforcement what to identify and how to deal with that. So, Carole White, how are we doing that?
So we are working, one of our partners for the Dementia-Friendly San Antonio is Bexar County Sheriff's Office, and we're working with the department to do training with them about what is dementia, how do you recognize it, and how do you respond with people. In terms of what Louis was talking about, these behavioral challenges, we now understand them to be unmet communication needs. The person isn't able to express themselves. So what are other techniques we can do to figure out what their needs are without thinking it's only aggression? They're trying to express themselves. So it's training like that with the sheriff's office, giving some of the statistics that Ginny talked about, the high percentage of people that wonder, what do you do when you see that? So we've started that ongoing training with the office, and it is ongoing. They're taking the Dementia Friends training program as well. And we're also identifying champions within that department who can continue the training after we leave, so we don't always have to be there, so it'll be a sustainable training program.
And so we talked earlier about the difference between dementia as a broad term, it's an umbrella term, and then there's Alzheimer's, and we're also learning that Alzheimer's is also a very broad term too. But there's other conditions that may not be memory loss, but they could also be other conditions of the brain and space and things. So can you talk about that, Carole White, other types of dementia that people should be aware of?
So dementia really is the umbrella term that describes some kind of problem with function in the brain that has to do with communication, memory, inability to focus and pay attention, reasoning, judgment. And Alzheimer's, people often talk about them interchangeably because Alzheimer's accounts for at least 60 to 65% of the cases of dementia. Something else that's quite common in South Texas is vascular dementia, which really is a multitude of small infarcts or small strokes that eventually have a cumulative effect and lead to dementia. And that's probably close to 30% in South Texas. People may also have a mixed condition that's both, and then there's less common causes of dementia, frontal temporal dementia, which tends to be a lot of behavioral challenges, communication, and then also dementia with Lewy bodies, which is often related to Parkinson's disease. Those are the main untreatable causes of dementia. One of the first things when you start seeing someone who has some of those symptoms is to see your doctor, because there are many treatable causes, a long list, and that's really what physicians do, is try to rule out what are the conditions and treat what they can treat.
Right. So I want to get to this point. I think it's really important. Being a dementia-friendly city means that we should have the resources available to identify and diagnose dementia early. And so can you, and so Charles Reed, can you help us with that?
As far as diagnosing, there are new tests that are coming out.
So people should take part in baseline testing.
Definitely take part in any of the clinical trials that are available. I mean, the clinical trials are out there. They are looking for people to participate. They need people to participate if we're going to find a cure. But also participating in clinical trials that will help us identify Alzheimer's and these dementias earlier on. I mean, there's some really promising tests coming out that are about 80% accurate. Hopefully they can improve that over time, because once again, if you can identify, if we don't have a cure but you can identify it earlier, then maybe there are things that you can do to help prolong your cognitive ability, keep those family members engaged in community activities, but also start planning. So what's going to happen when you're not comp anymore? Do you have that living will set up? Do you have those advanced directives? So the earlier that we can diagnose, and hopefully the earlier that we can treat, the better off we all will be.
All right, got an email from Catherine. We lost my mom 2 years ago from early onset Alzheimer's. People should know that once patients have been diagnosed and are needing assistance, they qualify for hospice care. Many of us tend to think of hospice only as a resource for the last few weeks of life, but there are many people with dementia and Alzheimer's that are on hospice for several years. And can you react to that, Ginny Funk with the Alzheimer's Association?
Sure. So hospice is absolutely a benefit through Medicare that is available. And unfortunately, that's another part of education and training. When people hear hospice, a lot of times they immediately think about death, that hospice equals death. But actually, hospice is a benefit that, particularly for families who have a loved one with dementia, they can utilize this whole hospice program. And you do have to qualify medically to be on hospice, but you can be on hospice, yes, absolutely, for months, sometimes for years, again, depending upon if you qualify. And it's like having an additional set of, you have a chaplain, you have a nurse, you have a social worker. They're not around 24/7, but they are a team of professionals who can absolutely help you as you are going through really what would be considered the later stages of Alzheimer's and other dementias. But again, we know that people can live for years in those later stages. So hospice is definitely an underutilized benefit that it doesn't mean your loved one is going to die tomorrow, but unfortunately what happens is a lot of times people will get signed up on hospice and then in a week they do pass. And in that case, we know that they just waited too long to utilize that benefit.
Another caller, Jared. Hi, Jared. Welcome to The Source. You're on the air.
Hi, thanks for taking my call. I appreciate it. My comment is that a lot of times people that are dealing with, Alzheimer's and other dementias, their family members are taking the brunt of that work, and those caregivers may not even know that they're caregivers. And I work for a nonprofit here in San Antonio called the WellMed Charitable Foundation. And I just wanted to mention that we have programs that are caregiver SOS programs that offer stress busting, caregiver coaching, teleconnection services, and that can all be found at our website. It's the WellMedCharitableFoundation.org, and that's all free of charge for family caregivers.
Jared, thank you for the call. Carole White, caregivers, there's a lot of burdens being placed on their shoulders, financial and emotional. It's a lot. They need to be able to emote and talk and help in coping.
Yes, we know that caregivers often take on the role, and they do report positive benefits, but the majority do report the physical health problems, the emotional, social, and financial. About 70% of caregivers actually change their work habits to be able, either going part-time or stopping work altogether, to be able to accommodate the caregiving role.
You hear about when you're a caregiver that you can lose your identity. Mm-hmm. that becomes your identity, and that is takes its toll psychologically. Mm-hmm. And you help people with that.
We do. We talk a lot about self-care. Jared called in about the Caregiver SOS program, which we also work closely with. But we really stress the importance to family caregivers that you're still you, and you need to take care of yourself. You need to take time for yourself, which may seem difficult in the day, but even teaching them short relaxation exercises, breathing, things that they can do in terms of their own self-care. And we know that caregivers also neglect their own health care, and so stressing the importance of continuing to have their appointments, have their preventative health care screenings, the things that they do, because I've talked to a number of caregivers that once their loved one passed away, they were dealing with health issues that became much more severe because they weren't able to catch them earlier on.
And Ginny Funk, do you talk to caregivers and you hear, I read about caregiver guilt, So like when Arturo called up, he says it's going to take a lot of patience, and eventually your patience runs out, and you need to have a minute to yourself, and maybe you snap, then you feel like, why this is not right, and you feel guilty for it. But how do you talk to people about that?
Absolutely. And that's something that I very much understand and can happen continuously all day long. It's very easy to get frustrated if someone keeps asking you the same question over and over and you keep answering. Or you're asking someone to do something and it may seem like, well, they're just not listening to me, but actually they're not understanding what you're wanting them to do. So it is easy to overreact, to get angry. And what I would say is that the last thing I would do is say, don't feel guilty. Because if we could turn it off that easy, that would be a miracle. But that's not it. Accepting the fact that you are doing the very best that you can in an extremely difficult situation. My mentor, Miss Nancy, I can hear her saying that to family members over and over, and then saying it to me, just repeatedly saying, you are doing the very best that you can. When you get angry, learn about communication skills, learn about tips to how to react to someone. And when you get angry, the best thing to do is step back, remove yourself. If you have to go around the doorway and scream into a pillow or whatever you have to do, but understanding that whatever your loved one is doing, they're not doing it on purpose. It's part of the disease. And taking a break. And yes, we all feel guilt and we feel that we're just not able to do enough or whatever we do is not right. But get support from other people. Go to a support group and hear from other people that, look, you're in a really, really difficult situation and you're doing the best that you can. You can always learn and try some more tips, but just keep learning and reach out for support.
And Charles Reed with University Health System, I guess you're going to be bearing the brunt of this, because as this problem grows and grows, the health system has a lot of responsibility, and you guys there's no place to run for you guys. You're right there.
Correct. And if you look at the statistics, so by 2050, we will see a 187% increase in people over the age of 65. And we know that those are the most people that are affected by this. And so once again, it's going to be, how can we best provide training to healthcare providers? But as a dementia-friendly, it's the community. And so it's, how is it that we can help support banking and grocery stores and everybody else to help identify and bring that dementia awareness? We've done several dementia awareness events in conjunction with the School of Nursing and the Alzheimer's Association, and helping bring those community resources together, because people have no idea of the availability of those resources. People come into our healthcare organizations because of another condition with their mom who has Alzheimer's, and the responses were extremely positive, and they want to know, how can we have more community events to get the word out, because people are living with this every day.
Sure. Like if a cashier from HEB, I bet the cashiers from HEB come in contact with every person in San Antonio. So if you can reach them and train them and help them understand that, you've reached a key part of our community that comes in contact with so many folks.
Yeah, and it's also helping keep everybody safe, because it's the cashiers and the bankers and stuff who may pick up on, this person really doesn't understand how much money they're giving me, or they just left their credit card here, and so it's really helping to protect our community.
So we have an email from James. Are there tests for early detection and prevention methods? Ginny Funk, and you wanted to talk about the organizations here in town that do clinical trials?
Absolutely. So diagnosis of Alzheimer's disease is extremely important. It continues to be difficult because it's not like other diseases. You can't just go in and get a blood test and find out, okay, this is Alzheimer's. You have to rule out, make sure that those dementia symptoms aren't caused by an infection or another disease, et cetera. So yes, the tools, there are a lot of tools available. You really need to find, and everyone here, we can talk about, you can find resources of a neurologist or a geriatrician, a doctor who really specializes in being able to make a diagnosis, because unfortunately there are still situations where people get that tap on the shoulder, oh, it's just a little bit of dementia, and then they're sent out the door. That's not helping any of us. So
yeah,
yes.
So dementia is not necessarily something that comes along with age.
Correct. Alzheimer's and any other kind of dementia are not a normal part of aging. Thank heavens. We are not we're all going to get old, hopefully, but we're not going to all get old and get Alzheimer's disease or Lewy body disease or any of the other dementias. So not a normal part of aging, although it still gets treated like that. So it's really important, yes, if you're concerned about any symptoms, to go get it checked out because, as Carole said, it might be treatable and reversible. It might not be Alzheimer's, but the other part of that is clinical trials. Like other diseases such as cancer, the only way that we're going to come up and find a cure or a treatment or prevention of Alzheimer's is through research, clinical trials. And there are clinical trials that are happening right here in our community.
A lot of them.
So Trial Match, and it's you just go to alz.org/trial match, or you can just Google Trial Match. And Trial Match is the entity that can pair you up with, just based on initial demographic information, to see if you might actually be eligible for a clinical trial. It's not enrolling you in research, that's not it, but it is based on the confidential profile that you set up for either yourself or your loved one with Alzheimer's.
And that's a way to get tested or to get a benchmark.
Absolutely.
And so they can, and we're quickly as we close, so Carole White, where do you want San Antonio to be? Do you want us to be the very best dementia-friendly city in the world? How do we do that really quick?
Okay, of course I want us to be the best. We're the third in Texas. I think, again, it's a grassroots movement, talking to your neighbors, talking to your friends, talking to your organizations about dementia and looking at ways to support people becoming a dementia friend, dementiafriendsusa.org.
And bring down stigma, shatter isolation. This is a community solution for a community problem. I want to thank all of our guests, Carole White, Charles Reed, Ginny Funk. This is The Source on Texas Public Radio. Thanks for tuning us in.
This has been The Source on Texas Public Radio. The Source is hosted by David Martin Davies, produced by Kim Johnson and Dallas Williams, with production assistance provided by me, Ruben Garcia, and Jan Ross Piedad. Dan Katz is TPR's news director.